Thank you, Dr. Mohammadi, for joining the Baptist Health System and the questions that we'll go through today. We appreciate your time. Let me ask you, during this COVID pandemic, if someone is experiencing a problem that might be emergent, should they go to the ER or call their doctor?
Well, that's a good question. A lot of patients that have established disease processes that their physician is well aware of, I think it's important for them to call their physician first. This way, they can find the right avenue to seek help and care, whether it be going to their doctor's office or their doctor directing them to the emergency room to have some kind of emergent evaluation. Oftentimes, it's very difficult to be able to go to your doctor's office, if it's closed or not, but sometimes your doctor's office will be able to accommodate the patient to come in to help avoid the emergency room and risk of exposure. But sometimes that's important to be able to know that the emergency room is the answer, and that your doctor is aware that you're going to be going to the emergency room, so that they have it on their radar so they can come quickly evaluate you.
Why is it important for a patient to not wait to go to the ER if there is something emergent?
So it's important to be evaluated in a timely fashion. An emergency room, that's what they're built for, is to be able to evaluate patients quickly, to triage patients, to find out what the urgency or emergency is, and to be able to contact the appropriate consulting doctor or for the emergency room doctor themselves to handle the situation. And this way, what you're doing is you're avoiding the disease from getting worse and leading to further complications.
What are some signs or symptoms that someone should be aware of that might indicate a vascular issue?
So common vascular issues that we encounter, particularly in our system, are peripheral arterial disease, which can affect your legs or your arms, where you can develop wounds, pain, swelling. Any one of these issues are urgent or emergent in our eyes. We need to be able to evaluate quickly to see what the problem is. This has been able to help us prevent amputations when not necessary, because one small ulcer can turn into an infection that can become more serious over time if not evaluated quickly. So those issues are, in our eyes, very urgently needed to be evaluated, whether in an emergency room or to contact your doctor, so that way they can find out a way that you can be evaluated quickly.
Let me ask you, in our COVID environment right now, what are some things that you see are being handled differently within the Baptist Health System? And also, I guess, in relation to some of your surgeries and procedures, what steps or protocols might be different?
So the one thing that we do, within the Baptist system and in my practice, is to be able to evaluate patients first. See if we're talking to the patient on the phone or via telemedicine, I first start with screening questions. Within the Baptist system, there's protocols in place to be able to keep the patient safe, the healthcare workers safe, as well as their accompanying family members. So first and foremost, if patients are having fever, cough, digestive system issues such as diarrhea or abdominal pain, these are triggers to be able to screen the patient for COVID-19. The Baptist system already has very efficient and rapid ways to be able to test patients for COVID-19 prior to going on to take care of the actual issues at hand that might be non-COVID related. So I screen my patients for COVID-19, and even prior to that, I ask them questions that would trigger to see if they need an urgent nasal swab to check for COVID-19. And if the patient needs a procedure, I have them come in with no family members if possible. There's some instances where a family member is needed, but it's important to keep your family members safe as well. In the hospital, we take care of a variety of diseases, but making sure that your family stays safe is very important. All the healthcare workers wear masks at all times in the hospital and follow not only the sterile procedures that we normally follow, but also going an extra mile to make sure that both the healthcare workers and the patient stay safe.
Thank you. I think you answered a little bit. Can someone accompany a person to the ER or for a procedure? For the ER, is anyone allowed right now?
So each hospital, even within the Baptist system, I believe, has their own protocol in place to whether a family member is allowed, and it also depends what's going on, what kind of surgery it is, what you're hospitalized for. As of now, I encourage patients, if they can, for me to communicate with the families by phone. This keeps the family safest.
Sure.
Being able to stop the disease process from going around, COVID-19 being a respiratory illness, can travel very quickly from person to person, and sometimes patients can have no symptoms. So if I could limit the exposure of family members, I do. And I make sure to call the patients myself and other surgeons that I know. We've been calling our patients' families post-operatively to make sure that they're well aware and answer any questions about what happened during the surgery, and to ensure that their family member is doing well. I think this is the most important thing. The patient should know that they getting urgently evaluated is important, but also keeping their family safe is also very important.
So let me ask you, Dr. Mohammadi, before we started this interview, we talked a little bit offline about, what we've been hearing in the national news, people who may not be getting the care that they need in relation to stroke or heart attack. Can you talk a little bit to that, please?
Yes. So stroke, as well as other cardiovascular diseases, remain the very important things to be evaluated quickly. The other issues that they carry a high mortality rate or high death rate. Although COVID-19 does exist and hospitals are helping take care of patients that do have COVID-19, it's important to know that strokes still exist, and so do heart attacks. So being evaluated urgently or emergently if you're having symptoms of stroke, such as facial drooping, you're having any kind of visual disturbances or loss of function in any of your limbs, to be urgently evaluated, because these are diseases that can be treated still rather quickly. And although there is, I know, a common fright of COVID-19, it's important to know that the hospital systems, particularly the Baptist system, is well fit to be able to separate patients that are under investigation for COVID-19 and patients that have other issues such as strokes or heart attacks, and that they need to be evaluated quickly. And all doctors on hand that are helping take care of these strokes and heart attacks are still readily available.
So there are different paths for heart attack, stroke, as opposed to a COVID patient. They're completely separate.
Absolutely, yes. And when I go see a patient in the emergency room doctors over these last several weeks have been very keen to inform me, we have an active COVID-19 patient, but they are in isolation, or they're under investigation and they're in isolation, and they're being well separated from other patients. So it's important for me as a healthcare worker, but I think it's more important for the patient to know that the risk, although it's there, it's being well taken care of in terms of separating the patients under investigation or the patients that have active COVID-19, whether it be in the emergency room or on the hospital floors. They're not mixed in together. The precautions are being well taken care of, that the healthcare workers that are taking care of those COVID-19 patients are taking their own precautions, but also staying separated from taking care of patients that have other things that are going on.
And a person's outcome, they should not wait to get to the ER, because the quicker you can get there and get treated, your outcome of a stroke or a heart attack is much better, I would imagine.
Absolutely, yes. There's timelines to be able to take care of heart attacks and strokes or any other vascular issues, and prompt evaluation is very important. So I encourage patients to not wait if they have an issue, whether it be a stroke, a heart attack, leg pain, leg swelling, to seek urgent or emergent medical care, whether it be in an emergency room, calling their doctor, but not to wait.
Thank you, Dr. Mohammadi, and thank you, PVA, for answering these questions today. We appreciate it.
I'm happy to be here. Thank you very much, Mary.